guess in summary, the real thing is brushing and flossing, really super diligent oral hygiene, thorough dental exam, photos and or models. Sometimes we'll take models of people's teeth so we can see over. If we suspect there's an ongoing change, the models can be very helpful so that you can identify any change that occurs. Regular cleanings, a systematic approach to correcting problems, kind of a game plan, a strategy to tackle problems. Everybody's different. I mean, everybody has a different set of teeth, and it's important to kind of, I guess, educate your dentist, because your dentist isn't going to know about this. I mean, I really didn't know as much as I recognize now that I should have until very recently. There are some people for whom over time we see that teeth move somewhat as, if you call it, I guess you could say aging. As teeth become, for a person without acromegaly, if they have gum disease, then teeth can become less supported. If the support structure for a tooth kind of shrinks, you think of the roots of teeth being shaped like ice cream cones, and they're all kind of stuck in the bone. As the level of the bone around those ice cream cones kind of goes down, then the amount of that ice cream cone that's stuck in the bone is going to decrease, and it's going to get less and less over time. So you're going to get some mobile, so you'll get less support, and those teeth will be more vulnerable to movement. And that's what we see in general in people with and without acromegaly. So for the general population, if you get decreased bone support with gum disease, then you can see teeth moving over time. So that would be probably what your dentist at that time was thinking of. But with acromegaly, it's very, very different. You see very distinct facial features, the growth of the lower jaw. The movement of teeth in acromegaly, from what I've seen, is accompanied by a corresponding growth in the jaw. And if a dentist has been seeing a person, especially over time, then certainly I would now. I think I would see that now. That if I saw a person with a very large lower jaw and spaces in their teeth, then I would start to talk to them a little bit about, maybe being checked for acromegaly, having the blood test for that. But that's the thing that would really distinguish people for acromegaly versus non-acromegaly. The other thing that with acromegaly, it seems that the spacing is more in the lower jaw. So for people who have spaces in their teeth that don't have acromegaly and their teeth are splaying, well, if you got gum disease, typically it happens top and bottom. So if you see just spacing in the lower arch, I'd be scratching my head as a dentist saying, geez, what's going on here? Why is there spacing happening only in the lower arch and not in the upper arch? People with acromegaly also can have gum disease. If you saw that sort of movement in a person without gum disease, I'd be looking at their bite. I'd be looking at all sorts of things.